You're welcome back. This is Newsfile, it's the most authoritative news analysis platform. And here on Newsfile, we put Ghana first. Let me go straight to introduce my guests who are helping us to discuss the first issue of COVID-19 and how to chart a path of safety in the Easter season. Dr. Patrick Abuaje is Director General, Ghana Health Service. Also, Kwame Sapong Esiedu is pharmacist and fellow Ghana Center for Democratic Development, CDD. Thank you so very much, gentlemen, for making the time to join us this morning.
Thank you.
Thank you. Great. Great. So let me start with Dr. Abuaje. So obviously, it looks like we are learning our lessons from what happened when we relaxed in December and there was a spike. Yes, even though we are recording, the numbers are beginning to reduce. We know that the death levels have been high. So once bitten, like they say, twice shy, yeah?
Yeah.
So these new measures, very exciting. I have seen armored vehicles on the beaches, and clearly the beaches have been empty since yesterday. It does appear the same thing will happen today and going through the season. How exactly would this impact on our management of COVID-19?
Yeah, thank you, Samson. Peace to your listeners. If you look at what happened, what is happening now, we are currently, our figures, and in terms of the daily numbers, is just the pre-Christmas ones, or probably early September, late September figures. And like you said, we've been through that trajectory before, and we moved into this space. How do we get this? What is the problem? The problem is that any festive occasion has a problem for spiking as long as the COVID-19 is concerned. COVID is spread by contacts and closeness, and this festivity brings a lot of people together, and then they all spread to their homes. And so the things we are looking for, we have to prevent the mass gatherings. And after the mass gathering, they go home and you have family clusters. People visiting people in their homes, and as part of our culture, it's another way of spreading the virus. And subsequently, 2-3 weeks later, it comes to the workplace, and then we have a major spike across the country. This is what we're trying to. So we can see that there's some effort in ensuring that the mass gatherings do not take place. Ghana Health Service has issued a statement yesterday trying to discourage people that this home visiting friends and loved ones for Easter, it's not, but is there any other way we can do without going there? Because it's a major way of spreading the virus. And of course, subsequently, it goes everywhere in the country. That's what happened. And so we are happy that at least something is being done. Probably Christmas, we lost that. Maybe enforcement was not proper. And people also did not comply, despite of the numerous messages that were sent across the country. People did not comply. And we lost 400 people in 3 months compared to 335 in 9 months. And so you can see that it's a major threat that as a country we must all sit together and ensure that we don't repeat what happened in Christmas and the sufferings of January, February, and early March. Thank you.
Isn't this what we should have been doing all through, rather than wait until the festivities and heighten it the way we are doing? Because it does appear that until now, we can't seem to be bothered, even though there is the latest executive instrument by the president that bans all these activities that we are now seeing letters or releases being issued here and there, and the president himself having to speak and to say that these will be enforced strictly.
Well, Samson, I think this is more of a risk communication, and we have started long ago. But remember that even the IGP had initiated the compliance system long before this hike and this communications, and even for our own communication. Maybe something, this discussion should have taken place last Saturday.
That's right.
So I believe that it's never too late, but some things were done, and I believe that with the risk communication, people were already wearing their masks, and we had probably the highest proportion of people wearing masks and social distancing. We see the number coming down, but we also see that we've been there before, and the threat of Easter, people are going to let go, and if you don't take care, we get back to where we were before.
Right. Now, Kwame, in the latest executive instrument, which is EI 37, issued by the President in January 2021, among other things, it is so clear in the section 1 of it, it says that there is imposed by this instrument restrictions on public gatherings, including 1, beaches, festivals, pubs and bars, including hotel bars, weddings, funerals, concerts, and theatrical performances, parties, cinemas and movie houses, nightclubs, large political gatherings and rallies, and large religious gatherings such as crusades, pilgrimages, and conventions. But it makes an exception for funerals, for a maximum of 25 people to gather. Then it reinforces the wearing of mask when you are in the public, leaving or returning to your house. So why do you think we don't seem to feel that this is in place until now?
Well, thank you, Samson. There are a number of things. If you look at it critically, we are generally a lawless people, and sometimes people cringe when you say things as bluntly as it is. And therefore, just having a law in place with all the intentions, without enforcement, would let people go by their default, which is to be lawless. So if you look at the, the executive instrument, it virtually covers anything that you'd expect to be covered by way of public health constraint and containment. But if you look at the behaviors that we're seeing even prior to this Easter, and I was monitoring social media and the electronic media on Thursday, and there was traffic all over Accra, people trying to leave the city, and that concerned me a bit. It concerned me for one reason, because, like you said, there are armored tanks and other things on the beaches are being protected. It gave me the impression where people thinking we would rather leave Accra and go and do it elsewhere. And if that is the case, then we are letting ourselves down. This is way beyond the Ghana Health Service. This is way beyond government. They can promulgate all the things they have to promulgate. They can put in all the enforcement measures. But if we go into our little niches and we go and meet in our households, especially when you've traveled from a hotspot like Accra, and you go to maybe the central region, Kumasi or other things, and you go and meet people in close quarters, and you don't wear your face mask and other things, all you're going to do is spread the disease. And that is my biggest concern. I'm just hoping that I'm wrong. Because what we're seeing in Accra is great, but it's the same being replicated across the country. If you listen to Dr. Abuachi, he was emphatic in saying that one of the things they are concerned about is the close cluster meetings during festive periods. And yes, after that, between 14 and 21 days, it's going to appear in our offices. So it is good what we're seeing, but let's hope that in the regions, a similar picture is occurring as well.
I have had an indication that even some churches, and I mean churches, places of worship, are not keeping to the mandatory rules, particularly where the numbers are to be reduced and they are to do only 2 hours, not more than 2 hours. How does it feel?
Well, and that's what I said, that by default, we are lawless people. And lawlessness doesn't apply to only professionals like yourself, lawyers, journalists, doctors, pharmacists, engineers. Lawlessness applies to all the cohorts of our society. So the churches, the mosques are no exception. And to be fair, it makes me cringe because faith is supposed to be redeeming. Faith is supposed to be reassuring. But if to go and practice your faith puts your life and the life of the general population and the public health legal framework at risk, then I would question whether you are actually being calculated in ensuring that you practice your faith. So I'm very uncomfortable with what I see about the churches, especially when you look on social media as well, and you see placards and billboards of churches advertising all sorts of things. I'm just hoping they are adverts and they are not going to go ahead with them, because if they go ahead with them and we have another uptick, that would be rather unfortunate.
I had not intended to bring in Yabuabinga somewhere at this point, because it's not supposed to be part of this first session. But Yabuabinga somewhere is here. He's Director of Communications, the New Patriotic Party. Wabi, what do you make of the implementation challenges, enforcement challenges? If you talk to the police privately, they will tell you they are doing everything they can, but this is overwhelming.
Thank you.
If they say don't assemble more than 100 people, don't do this, how are they able to police all of this? And the thing is that churches are violating it. Churches.
Thank you, Samson. Thank you to your viewers. I haven't been on Newsfile for a very long time, so let me say a special hello to Adentan constituency and my party, especially His Excellency the President, Vice President, and the leadership in Jubilee House.
Yeah, the people who asked for footbridge, it was done for them. They are not using it.
So we come back, and I'm thrilled to hear what's coming from CDD. We come back to the question of rule of law, where we assume that we deserve all the rights, but none of the duties ought to be imposed on us. Rule of law is a balanced equation. You must have rights, and I listened to your take very carefully on the footbridges, on the enforcement measures along the public transport, commercial, roadside stations and all that. And the question is, how do Ghanaians as a people perceive their duties to themselves, to each other, and indirectly, therefore, to the nation? Very little. And it is troubling. You have a situation where sometimes to enforce, you have to use excessive force, which under normal circumstances ought not to be the case. What you just called punishment, on the spot punishment by the police and otherwise. But sometimes there's an assumption that that is the only language people will understand. It's not ideal. It ought not to happen. But the question is...
It's not a question of it's not ideal. It's unlawful in the first place.
It's unlawful, and it ought not to happen.
Right.
But the question is, how do we progressively get people to assume their rightful duties? And we have a situation of COVID, and I disagree with you that we haven't been dealing with the measures. The approach has been to progressively expand the spaces beyond restriction, expand the spaces. But then you have a special occasion like Easter, then you must hike up what you're doing.
What do you mean by progressively expand the spaces? What does that mean?
You know, we started from a serious situation of restrictions back in March 2020. And then we lifted the lockdown. And then we had situations where transport operators couldn't take so many people. And then we relaxed it and said you could take a bit more.
Right.
Because now you are expanding. Then we didn't used to have funerals at all.
Yes.
Then we said that, okay, you can have 25-man private burials. We expanded access to education, where a situation where we had shut down everything. Now we said that children needed to go to school, but we put in the appropriate protocols to protect them. Then we partially opened the social front. You could have a meal, provided it was properly isolated, or you could go in and take a meal away.
Right.
And in all of this, commerce continued. General commerce, and the assumption was that if you were going to go into a commercial area, you would be protected.
Right.
Everything would be provided for your use and your need in terms of protocols.
Right.
So that is what I call progressive opening up of the spaces because we are aiming to hit normality.
There are too many people not wearing the mask and they cannot be bothered. Meanwhile, it's a crime not to wear the mask.
And you see, the tilting point about enforcement is at the point where you can't arrest everybody. That's a tilting point. So not to get to that point means the population themselves must be conscious of their duties and be self-restrained. So our biggest problem, and it's the COVID situation, is a microcosm of what you were talking about, and it goes all the way up into our public institutions, where staff rules are not enforced, everybody seems to do what they like or otherwise. There's a certain pervasive sense of relaxed.
A very influential football administrator this week has been complaining why there have been restrictions placed on, spectatoring, and he says, why? Didn't we see what was going on? There was no in the midst of the restrictions, political activity was going on unchecked and so on and so forth. I feel sad about it, but do you get where he's coming from?
I do. And again, the political season was more or less, with hindsight, akin to the Easter season and akin to all the other periods when there is a certain specific time frame where people will gather, people will engage. So right from when the new register was being written, right through to when it was exhibited, and then the actual voting with the campaigning in between to declaration of results, there was a certain significant increase in the numbers of people congregating to do political activity. But yes, that's a period. Did we conduct ourselves well? Not entirely. But can that be compared to a regular recurring activity like football spectatoring, which will be week in, week out? Obviously, you can't relax and have the same assumptions for that kind of situation. But you can have limited spectatoring with the right protocols.
Right.
So if you don't implement that administratively, then he would feel right to be hurt. So for me, the progressive approach...
I say it's sad because I don't expect him to even use that example. The politicians were irresponsible. Therefore, allow us also to be irresponsible and to catch COVID-19 and die because of football.
Something. It is in the nature of human affairs that politicians are always on the receiving end because we happen to be a kind of breed where we are positioned for that. We are in leadership of the entire society, and therefore we become the lodestone, you see. But the bottom line is, how do we, as a society, ingrain respect for rule of law to the extent that people demand their rights, but at the same time, they're prepared to exert their duties?
Do you think we have failed in that direction, educating the people of their duties along their rights?
Listen to Article 41. I hope I'm not taking up your time.
Yeah, go on.
Because I was not supposed to be...
I love Post 41.
I'm not supposed to be in this segment.
Yeah.
But listen to Article 41.
Right.
The exercise, and this is the 1992, it's one of the most progressive documents in the world of democracy.
That's right.
The exercise and enjoyment of rights and freedoms is inseparable from the performance of duties and obligations. And accordingly, it shall be the duty of every citizen, A, to promote the prestige and good name of Ghana and respect the symbols of the nation. Do we? It's very easy to find Ghanaians denigrating ourselves and saying all sorts of things about ourselves. To uphold and defend this constitution and the law, that obviously is only left to the government and the Attorney General. Very few people uphold this constitution and the law. To foster national unity and live in harmony with others. We are doing relatively well there. We blow a lot of hot air, but we are very humane to each other. D, to respect the rights, freedoms, and legitimate interests of others, and generally to refrain from doing acts detrimental to the welfare of other persons. That is probably where we do our worst. Everybody wants something to go for their benefit.
If you are not wearing the mask, you are endangering the next person by you.
They don't care. They think it's not necessary, and they are not interested in the other person's welfare. To work conscientiously in lawfully chosen occupation. So people go to work late, close early,
Exactly.
and whilst they are at work, they are either looking at their phone or doing their private jobs or leveraging government opportunities to do their own things. to protect and preserve public property, and expose and combat misuse and waste of public funds. The question you're going to be asked is it your father's job? That's what you're going to be asked.
Yeah.
To contribute to the well-being of the community where that citizen lives. People dump rubbish right in front of their home, the expectation that the government will, without expecting to pay for the collection. The assumption is that rubbish will disappear.
We wait for the rain and then we drop them in the gutters.
Brand new constructed gutters which are not finished. Modern roads being constructed, and already the drains that are being constructed are choked with plastic waste because people deliberately dump waste in them. To defend Ghana and render national service when necessary. Probably that one, the soldiers are serious. The national service is a very good. To cooperate with lawful agencies, the maintenance of law and order. To declare his income honestly to the appropriate and lawful agencies and to satisfy all tax obligations. Another wahala. To protect and safeguard the environment.
Right.
Article 41 is at the core of what we are discussing today.
Right.
If we were to internalize Article 41, we will be a beautiful society because we have sufficient here to organize ourselves well, provided we have that.
Okay. All right. That's interesting perspective that he brings on. So let me return to the experts on the matter of the COVID. Dr. Kumabwaji, what's happening with the expected nationwide general vaccination exercise? Soon after the first batch of vaccines arrived, we were informed, and you confirmed here on Newsfile that we had received vaccines from elsewhere as well. And within a matter of a week or two, we're expecting several from various other quarters. What's going on? Please unmute. Please unmute.
Yeah, thank you, Samson. Just before I go there, allow me to just make a short statement on the enforcement. I think COVID, we are balancing health, social services, and economy. Can you imagine arresting all those people in Medina into the prison cells? You'll be promoting the same COVID, you'll be spreading the same COVID. And so what we have been doing is engagement early. And even though before Easter, we had engaged the chiefs, we had engaged the local government, we had engaged the churches. That's why they came out with the circular banning conventions, etc. But of course, there are many churches who do not belong to some of these organized groups. And so we also engage the local government to ensure that within the locality, some of this education and to some extent, some ensuring compliance takes place so that we do not. We have also engaged the sports that, yes, this festivity, we need to be very careful because the celebration is very difficult to contain. So that's the dilemma we are. But most importantly, I think we must ensure that the family visit, that is that those small issues that are the greatest challenge that we cannot control by the police. But nobody's going to tell you can't go to this house. You go to UK, you have to meet somebody, come out and meet them because they also identify that as a challenge. So that's what I wanted to say.
Yeah,
now,
but in respect of saying arresting people because they are not wearing masks, I remember that you did a lot of work to improve the mask wearing, very dramatically. I don't know if that is still going on, but the government had been, made aware that the law as regarding the mandatory mask wearing, it's simply unenforceable. The police have made it very clear that it is impractical. The government has been called upon to take the example of the whole municipal assembly, for example, where they had imposed spot fines. If you are not wearing a mask, you pay 10 cedis, 20 cedis, I think that's the maximum, and then you are handed mask. That is a more practical way of enforcing that rule. The government has not seemed bothered, and so get onto the street right now, and I can assure you that the first, perhaps 10 people you may count will not be in masks. That's sad.
Yeah, I think we are the best is for people to really come, and that's why we have also engaged the local government to also be an integral part of the fight. Yes.
All right.
Yes.
So
on the vaccines, yes, we have received so far close to 900,000 plus vaccines, almost 1 million vaccines, which currently is going on. We are still in the first phase where we are targeting health workers and other groups of people over 60s, those with comorbidity, security services, etc. Currently, we are doing all the health workers across the country, and then we are also moving to a few more regions since yesterday to do the same clustering of people, especially in the relatively hotter hotspot regions in the country. Yes, we're still waiting for more vaccines. There's been a lot of engagement, a lot of orders, etc. have been done. But as you are aware, there's a real global crunch for vaccines, and just like other countries, Ghana too is also working very hard to get our stocks. We have a few coming in, and the only problem, nobody's able to give you the exact dates, but periodically we get. Our greatest challenge is we are working towards getting from end of April. That's when the very first time those who took the first are supposed to take their vaccine. We deliberately chose 8 weeks, which is the minimum, but the range is 8 to 12 weeks, and the longer the duration, the better the response. And so from end of April to say end of May, we are hoping that we'll be able to get the people for AstraZeneca for the second dose. And so everybody, the minister, the president, my finance minister, everybody's working very hard together. We are confident that we'll be able to meet that deadline based on all that arrangement that have been done. At the same time, a lot of work has gone on into getting other vaccines. Now, you cannot just limit yourself to one vaccine, or you may not get enough of that. And so we are looking at Sputnik, we are looking at other vaccines, and there's a lot of activity taking place. And we are hoping that we are still vaccinating, that what we want to do, that we don't stop vaccinating, that we'll get some to continue until our deadline of October, where we hope that a significant number of people, about 20 million people, would have been vaccinated. We're still keeping hope alive for that target, and we believe that with the activity done, and I think in the world, when there's a crunch like that, there's response. Most of the factories are expanding their production, etc. And we are hoping that based on that, we'll be able to, if India starts exporting AstraZeneca, we should be able to get ourselves from COVAX and all the bilaterals that the government is making.
Kwame, from what you have monitored so far, are we really on course as planned?
Thanks, Samson. You see, the vaccine supply chain was always going to be tricky. And though we've gotten to this point, some of us are not surprised. The point is, on Tuesday, the WHO issued a statement where they actually said that there was a delay to COVAX of 90 million doses of vaccines. 40 million that wasn't delivered in March, and 50 million that would not be delivered in April. They also issued guidance on how countries who were reliant on COVAX should operate in a vaccine-constrained environment. They have indicated that the vaccines should be coming in June. The problem now globally is the way the European Union is behaving. Because if I listen to Dr. Abuaji well, he was talking that they are trying bilateral agreements with Sputnik and other things. Currently, the European Union has jettisoned towards Sputnik, and they are not actually speaking to Glameya, they are speaking to Vladimir Putin. There have been 3 conference calls in the last 3 days between Putin, Merkel, Macron, and von der Leyen. And because the Russians also have sanctions against them, Putin is also trying to play his game properly, because there's a geopolitical undertone to all this. He's trying to play his games properly so that he can also get these sanctions removed. As that is going on, the European Union are also in a tug war with AstraZeneca because of UK. And while that has been going on, the major supplier of AstraZeneca, which is Serum Institute of India, have also got a caveat, which was actually issued in January by the Indian government to say 50% of all their supply should go to the Indian country because they are having a wave. However, when it was issued in January, India didn't enforce it because there were blocs like the EU who quietly spoke to India to say that they would struggle and other things. So India didn't enforce it. But 2 weeks ago, they suddenly started having a spike. So then they put their foot down and said, Serum Institute cannot export. Now, here's the case. The European Union is blocking exports already. They've blocked exports to Australia. They are now threatening that they are not going to allow the production plant of AstraZeneca in Holland to supply to the UK, which then means that the UK would not be able to meet its commitment to COVAX. So the main problem that concerns me is the fact that the supply chain would continue going through this geopolitical gerrymandering until the European Union gets its act together. And it's become so bad that even 2 days ago, on the 1st, the WHO had to rebuke the European Union. And you see, the WHO hardly rebukes. But when the WHO rebukes a bloc, the biggest trading bloc in the world, like the European Union, then you have to realize that they realize that the geopolitics is actually affecting the entire globe. If you then bring it to Ghana, you realize that the good thing for the likes of Dr. Abuaji was they got their vaccines first because of all our advantages when it comes to the expanded vaccination program and all the fact that we're always around the 90% and all that. But some countries haven't even received their first supply. There are actually 19 countries who've not received their first supply. And COVAX are saying that unless they've all received, they are not going to go into the second lock for, countries like Ghana. So I don't see us getting the vaccines by the 8th week. And I'm glad Dr. Abuaji has acknowledged in what he says. But their strategy, like when I saw the vaccination program, I said it was smart because they were looking at 8 weeks, but they knew that the window was 12 weeks. So we have 4 weeks within which we need to ensure that the European Union stops this bull in the China shop behavior. Otherwise, we would overshoot the 12th week. But I know that the WHO has issued guidance should that happen. And I'm quite sure Dr. Abuaji has a copy of the guidance and the stuff like that. So it is about risk communication. We need to be honest with the public and level up with them like I'm doing now and tell them that we could overshoot.
So my question to you,
acknowledge that.
My question to you substantively was, from where you have monitored events so far, are we on course? We were expecting, 2.4 million AstraZeneca shots through the COVAX by the end of May. And now we're being told that until sometime in June. Much earlier, you had suggested that we're going to get somewhere into, is it June, July? So are we on course?
Something, yes. Based on what I suggested, we are on course. The problem was we overpromised by saying we were going to get it in April. And people got very elated. But for those of us who look at the movement of drugs in international commerce, we had seen all these red flags. And that was why I said at that point, I think I was on the program actually with Dr. Abuaji, and I said at that point that though the president has promised, I'm a pragmatist. And looking at all the caveats, which now have become reality, we were not going to get it in April or May. And I said it because sometimes it's unfortunate. Some of the portals as I am on in the biomedical sphere, it's everything that you can come and put in public. But I had seen letters, I had seen emails, confidentially from the Indian Parliament going here and there. And looking at it all, I knew that these people were going to pull rank on us. And so I said it. And that was why I gave the caveats. Now the caveats are here. And the problem is, how do we go past the caveats? Unfortunately, we don't have a hand in it. We are bystanders because we were not at the table. We are not involved in clinical trials and all that. So it's not just Ghana. A lot of countries are bystanders, apart from Chile, which has played the game and therefore has more vaccines than it needs for 90 million people and already has the vaccines in the country and has production plants. Everyone else is a bystander. And that was what I was saying then, and that is what has put us off track now. But the reality is, from the timeline I had seen, even in the conventional COVAX document, which I had seen then, COVAX also were aware of all those things and knew that we were going to get to June.
Right. Dr. Kumabaji, my understanding from what you have said is that there's clearly no cause for alarm because even if we received what is required by May, or we didn't get it by May, but by June, there will not be problem. Is that not so?
No, that's not what I'm saying. What I'm saying is that, yes, we are not relying solely only on COVAX. We are doing other bilateral organizations. There are reorganizations to ensure that we get vaccines. It's not just COVAX. It's not Sino Serum Institute, but it's also other organizations, other countries that have stocks. Okay, we just received some from South Africa through MTN. Okay, so all these arrangements are going on to be able to get vaccines whilst we wait for the 6.4 million doses or 12.4 million doses from Cuba within whatever period they are. They have actually increased 30%. But the government is also engaging other bilateral. When I say bilateral, not just Sputnik or anything, but even others who may have the vaccines. There are countries who have vaccines that they are not using. The AstraZeneca locked up in countries, and I'm sure Kwame knows, who may not use them. And so there are all manner of arrangements that are being done. And so we are not just relying on that. We know we're going to have a challenge with COVAX coming in. There's also the private sector approach that there are private organizations that are also trying to find vaccines, and all that is, so we have multiple approaches to getting the vaccines. Yes, we are worried, but I believe that because we do not put all our eggs in one basket, we still hope that we might still be able to get vaccine. Beyond COVAX, we have received over 300,000 additional AstraZeneca, and these are the kind of arrangement that we are hoping that it will continue for us to continue vaccinating until the systems ease up. Yeah.
Okay, so I got my shot on the 9th of March, and I'm supposed to take my next one on the 5th or so of July, I think. Should I be worried?
Well, I mean, we gave you 8 weeks, so you have a 4-week grace period within which you can have, and we are working around the clock, even at this Easter period, to doing all bilaterals to ensure that we get vaccines to the country to continue vaccinating, Sputnik, etc. There are a few arrangements that have been done. So we are hopeful that we'll be able to meet that. And everybody's working very hard, including COVAX themselves, UNICEF, and all our partners are working very hard with that to ensure that we do not miss those targets. Not just that target, but we also have people who have not even received their first shot. And we are working towards getting all of them vaccinated. Because until everybody is vaccinated, even those countries who are trying to keep it and trying to bring COVID passports, still they are not safe as long as everybody else is not protected.
Right.
So I think there will be some global consensus that allows every country to protect it.
So supposing that some situation occurs, my second shot, can I get any other brand?
There's no scientific evidence now that if you take first shot AstraZeneca, you can take Sputnik second shot. But I also know there are studies going on to see how it works. And so until those results come out, we cannot propose that you'll be able to take another vaccine in lieu of, that's when you take one and take a second one. Even though they are supposed to be producing the same antibodies to protect you, the science is not there. We need to be very cautious to ensure that we have strong evidence of safety and efficacy before we can go ahead. There are studies going on, and I believe that even one that may be taking place in Ghana soon.
Please remind us briefly, where and when do we get to herd immunity? Which is the aim of the vaccination?
That's a very, very tricky question. It's a whole range of 66% to about 80%. And so it's quite tricky. But I believe that about 75% should help us. And under the current restriction, doesn't even take us to the 75% because currently because we are not giving to children under 18 and pregnant women, it takes out about, even if we can vaccinate maximum about 66% of the population. But there are new evidence coming out, maybe safer in children, maybe safer in pregnant women. So as the boundaries move, we'll head towards herd immunity. But one thing that people must know is that it's not so much about whether it is 94% or 70%. If you have a herd immunity, even for a vaccine at 50%, it's still protective enough.
Kwame, can you respond to that same question?
Yes, the herd immunity threshold is shifting. It's shifting because of the strains. You know, when it first started, the reproductive number, the R value, was around 3. With the UK strain, South African strain, and Brazilian strain, it's moved to about 4.5, 4.7, which then moves the herd immunity to about 81%. And that's why Dr. Abwaji is saying that between 66 and 80% should be fine. The problem under the constraint we have is that there's evidence coming that you are better off having a large number of people having their first shot compared with having a fewer people have 2 shots. Yeah. So you are better off a lot of people having their first shot, and that is what the UK has done. And that's what a number of countries are doing. So to answer your question, even though the herd immunity threshold is between 70 and 80%, if we can get enough vaccines to even in the next 5 months get about 60 or even 50% of the immunizable population, because the immunizable population is different from the general population. Our immunizable population is only 22 million because it's 62% of our population, because the rest are below the age of 15. So our immunizable population, if we can get 50% of them immunized, their first dose, and even we struggle with the second dose, reading the document from WHO about working in a vaccine-constrained environment, I would be much more confident. And why would I be much more confident? If you look at the Sputnik vaccine, it's actually 2 vaccines. It is not the same like AstraZeneca where you are injecting the same vector. There are 2 vaccines. You give the first dose and you give the second dose. That primarily answers that question of can you use 2 different vaccines? Sputnik have already done that, and that is why there are tests going on that if Sputnik has done it and is getting this immune response, can we not do it with other vaccines? And the data already has started coming out. I know the MHRA in the UK is reviewing some preliminary data on that, and I expect that in the next 4 or 5 weeks we'll have definite answers. But when you go onto immunological platforms like on Clubhouse and all that, a lot of the immunologists are veering towards the idea that that would be possible based on the way the Sputnik vaccine has been engineered. So that is how that's why I am quite relaxed about it, because I'm thinking the first dose, in fact, in the UK, the first dose has virtually decreased mortality to single numbers from when we're looking at 2000 and other things. So the emphasis for me should be to get as many people first dose immunized as possible.
And in that direction, what do you say? What do you feel about the progress so far?
Well, it is tricky. Like I said, the worst thing when you look at movement of drugs in international commerce is to be a bystander. And that is why, if you remember, something around November, I was on this same program, and I did say that we need to start thinking of being involved in bilateral, clinical trials and other things, because that's what Chile did. Chile is not a rich country. How come they are the 3rd highest when it comes to vaccinations? How come they are the 2nd highest when it comes to the number of people who've received 2 doses? And they have about 61% of their population receiving their first dose and over 22% of their population receiving the second dose. Why? Because all the vaccines you see on the market, from the Chinese to the Russians to the British to the ones that are coming, Novavax, they did clinical trials in Chile. And there are only 19 million people. But what the Chileans said was if you come and do the trials, you have to manufacture in their country. One of the conditions was you wouldn't import vaccines to come and trial, they needed to also get the technology to manufacture. So now what's happening? They've got 88 million vaccines for 19 million people, and they are giving out to Latin America. We could have done the same. We have Noguchi, we have Navrongo, we have KCCA, we have Kintapo. We could have done the same thing. And for me, that is where I feel a bit anxious that we did it. And now we are bystanders, and we are so reliant on all this geopolitics and bullying the China shop behavior from EU. So that makes me a bit concerned.
Okay, so very finally,
I can add.
Right. Okay, go ahead. I wanted to take your final comments.
And I think what Kwame is saying is very important. We need to participate. So I mean, whatever comes part is part, like been tested on us and it works on us. The last time I mentioned it, the media was on my neck. They want us to be guinea pigs. We tried, Ebola trial was aborted. We are doing malaria trials, and there was a lot of good about it, but at least now it's going on. And these are the things that we must contribute to the global knowledge and also be beneficiary of that. And that's how you get technology. The president is working towards us producing our own vaccines. You don't do that if you don't collaborate in such settings and get the knowledge to be able to do it. And I think it's about time, like I'm saying, that we start participating. There are safety measures that are put in place before you. So it's not just become like a guinea pig, but there are systems in place that protects people who participate in this clinical trials. I'm saying Kwame did that in the UK and still alive.
All right. So Kwame, I want you final take before Dr. Aboagye gives us his. What should the roadmap look like to get to, an assurance that we are safe in this vaccination period?
Well, the roadmap, like I said, we are bystanders. The roadmap should be bilateral conversations with the likes of, at the moment, the whole world, whether we like it or not, is at the mercy of Boris Johnson. How he managed to hoodwink the entire globe to be in that controlling position, because he's controlling remotely India and Serum Institute. The plant that has been built in Thailand was funded by the UK. He gave money for a plant to be built in the Netherlands for production of vaccines. He's controlling Novavax, which is coming. He's controlling Valneva. Regions from AU and all that need to be speaking to him, because now he's an independent person. He's not part of the EU or anything like that. Then we need to also speak to the likes of the EU. Some of the statements coming out of the EU are unhelpful. But like Dr. Aboagye said, if they continue down that route, with their vaccine passports and all that, they will still not be protected. Now they are in lockdown. Now their mortalities are even spiking higher than the UK, who they said were dying at the point when UK was doing all these things. So we need to look at this roadmap as a global collective and accept our limitations and the learnings from things that some of us were saying right at the beginning about participation and all that, and start being proactive. We can even now, it's not too late to say we want to be involved in the trials for between 12 and 16-year-olds, for example. It's not too late. If that happens, we would be in a position where there will be vaccines coming into the country. Because once the vaccines are coming into the country for the 12 to 16-year-olds, because that is not going to be double-blinded, considering that efficacy has already been proven, it would be safety to see if the vaccines are safe in that age group. But what will happen? The more people who participate, they will come as part of the number who go towards our herd immunity drive. It would cut transmission in that age group. We need to be very, very smart in playing this movement of drugs in international commerce games. There are so many tricks about them. Some of them I cannot say openly on air, but there's a lot that we can do. Serious things, we can shift the goalpost easily if we seriously want to. And I'm quite sure that Aboagye and Co, sometimes privately they know the sort of stuff we say.
Thank you.
We can do things.
Thank you. The final words from Dr. Aboagye.
Thank you very much, Samson. I think we are hopeful, and we are working, still using our segmentations, and just like as we've done, there's a lot of new learnings that comes up, and as we come up, if the evidence is that probably one dose is enough for you to go on, we may go along that direction. It depends on the learning, so we're still sticking to our projections on how we're going to go around it. But we are also open to the new knowledge that are going to come in, and that are going to guide whatever we do as far as colonization is concerned. But we are doing a lot of bilateral engagement. We are not leaving the COVAXs and the factories alone. We're engaging all of them to ensure that we have vaccines for all. Because this is a very good window for us. We are virtually coming out of the second wave, and this gives us a good window to vaccinate as many people as possible to avoid any further spikes in the country.
But you are certainly concerned that things are not, panning out the way you planned.
Yes, in terms of the vaccine supply, yes, we are. But we have also not given up, though, because we are doing many other things to ensure that we are able to get vaccines so that we don't meet the target. Because, like I said, this is a very, very important window. Today, we are reporting the same figures like late September, 80 cases, 21 cases. This is the time to vaccinate as many people as possible to look at. But like I said, even currently, we are continuing to vaccinate, and we are expanding to 7 other regions to start vaccinating. Hopefully, more vaccines will come in. We continue. Yeah.
Gentlemen, thank you so very much. Dr. Patrick Kumar-Boaje is Director General of the Ghana Health Service, and Dr. Kwame Sapong-Asiedu is pharmacist and fellow Ghana Center for Democratic Development, CDD.
Thank you.
Thank you very much.
To grow and fester, and you're being called upon to come and pay. And because we do not see an end in sight, and because we don't see the solutions coming, you're going to be called upon to pay.
So you expect utility prices to go up? I mean, electricity prices?
No, but there is no debate about that. This is a major tariff review year.
Okay.
So PURC, and I can imagine the difficult situation they may be in at this point, where the grid is not stable, and yet you have to review the tariff. So it's going to be a very tough decision for PURC to take.
What you say scares me. I mean, in back of all the budget taxes increasing, that
this year is a major.
It's a guarantee that we are going to see
that tariff will go up significantly.
When the time comes, we will inform Ghanaians. Currently, what we are doing, we have to be sure, because you cannot go and take off power and do nothing. We have to be sure of the time and the extent. So we are liaising with the contractors. Not only the contractors, ECD is also involved. NIDA, who is the project funding agency, is also involved.
What exactly is happening in the power sector? We'll be right back to deal with that.